for Disease Control and Prevention, and he will be updating us on the COVID-19 situation across Africa, including the Africa CDC's response activities as it leads that drive against COVID-19 among the member states of the African Union. And then today we are also joined by Dr. Matshidiso Moeti, who is the Regional Director of the World Health Organization, the WHO Africa region. And she is here to talk to us about vaccine acquisition in Africa. And then at about 25 past or 27 minutes after 11, we will then start our question and answer section. So please, if you have any questions, start firing them right away. And then, as usual, we'll then have our closing remarks and then bring the press briefing to a close. So let me now bring in Dr. John Nkengasong, who is the Director of the Africa CDC, for his briefing on COVID-19 across Africa. Dr. John, you have the floor.
Thank you, Wayne, and a very good morning from Addis Ababa and from the Centers for Disease Control and Prevention at the head of the African Union Commission. But let me first of all join Wayne in appreciating Dr. Moeti's time for creating the opportunity and time to join me on this press conference today, and to acknowledge her dedication and extraordinary leadership that she continues to exercise over the years in the fighting pandemics and epidemics and outbreaks on the continent. It's true joy, Chidi, to have you on this platform today with us at the African Union. As always, I will do three things: give you an update on the epidemiological situation, and then what we are doing, continue to do as Africa CDC together with, in partnership with others, and what the vaccine situation is, which will largely be covered by Dr. Moeti. So in terms of the epidemiological update, as of today, July 29, a total of 6.5 million cases of COVID-19 have been reported across the continent. And this represents a 3.4% of all cases reported globally. The number of deaths, total number of deaths for an entire continent stands at 167,000 people. Unfortunately, so with a case fatality rate of 2.5%. And that number of deaths, that is the 157,000, represents 4% of the global deaths as we speak. About 5 countries are contributing to more than 63% of the cases on the continent: South Africa, Morocco, Tunisia, Egypt, and Ethiopia. 4 countries are now reporting a case fatality rate that is around 5%. That includes Egypt, Sahrawi Republic, Somalia, and Sudan. And 56% of our member states, that is 31 countries, are now experiencing a third wave of the COVID-19, with 23 member states experiencing a more severe third wave than the previous wave. 2 additional countries, that is Ghana and Botswana, joined the list of countries with experiencing the third wave. And as we mentioned last time or last week, Algeria and Tunisia are experiencing the fourth wave already. In terms of variants, 38 countries are now reporting the Alpha variant, and we have no new additions to this list as of this week. 32 countries are reporting the Beta variant with no new additions, and 21 countries are now reporting the Delta variant, which we've not recorded any new additional countries reporting that specific variant this week. Now, let me discuss the trends. I would, as usual, we'll look at the 1-week trend that is comparing last week and this week, and then also look at the 4 weeks trend. So if you compare this week, this epidemiological week 29 with last week, which was the epidemiological week 28, we observed the following: that a total of 239,000 new cases of COVID-19 have been reported on the continent compared to last week, which represents a 15% decrease in the number of new cases. The highest proportion of new cases are from the Southern African region. That makes up about 57% of the cases, 30% in Northern Africa, 7% in East Africa, 5% in West Africa, and 1% in Central Africa. If we now look at the number of deaths, the total of 6,692 new deaths have been reported over this same period, that is from last week to now, representing a 9% increase in new deaths reported across the continent. So let us now look at the 4 weeks trends. That is the week between June 28th and July 25th. So there's been an average increase of 4% of new cases over that time period, with the breakdown as follows: 38% increase in Western Africa, 24% increase in Northern Africa, a 3% decrease in Central Africa, 1% decrease in Southern Africa, and a 0.1% decrease in East Africa. In terms of the new deaths over the last 4 weeks, we've recorded an average of 17% average new deaths over that same period, with the following breakdown in terms of the most populous countries: Nigeria, 29% average increase; South Africa, 27% average increase; Egypt, 32% average decrease; Ethiopia, 18% average decrease; DR Congo, 14% average decrease; and Kenya, no change. In terms of testing, as a continent, as of today, we have conducted about 58 million COVID tests. And last week alone, the continent conducted about 1.3 million tests, but that represents a decrease of about 19% over the previous week. The overall positivity rate stands at 11.2%, with a test per case ratio of 8.9, which means we are not testing at a level we should be testing. 31% of our member states, or 17 countries, are reporting test positivity rates of higher than 12%, which means or reflects an extensive community transmission. The Africa CDC continues to support member states in their ability to respond to the COVID-19 pandemic. Especially during this second wave, we have organized what we are calling the swap teams and deploy them to several countries, from Seychelles to Cameroon to Sierra Leone and Zambia, Namibia, to support them to fight the third wave. And I just came back last night from Tanzania to meet with the leadership of that country to continue to work with them and support the leadership there to implement a more aggressive COVID response strategy. That is all part of the SWAP team that we've deployed across the continent. I will, as I indicated earlier, leave the vaccine piece to Dr. Moeti so that she can expand on that. So Wayne, please, I'll turn back the floor to you. Thank you.
Thank you very much, John, for that briefing. And now let me introduce Dr. Matshidiso Moeti, and she is the Regional Director of the World Health Organization's Africa region. And as Dr. John has mentioned, she will be talking to us about the acquisition of vaccines in Africa. Dr. Moeti, it's over to you.
Thank you. Thank you very much. And a very good morning and good afternoon to all the journalists who've joined us this press conference online. I'm very pleased to join my brother, Dr. John Nkengasong, in this briefing. And I'd like to commend John for your leadership, for the intense and sustained action that you have put in place with your team to support African countries. It's absolutely unprecedented. And we are very, very pleased indeed to be working with you and your team. So in this briefing today, of course, John has already outlined the situation as far as the pandemic is concerned. And I'm going to say something to you about the ongoing efforts to step up vaccine acquisition, delivery, and rollout on the continent. As Dr. Nkengasong has said, the continent is still in the throes of the pandemic's third wave, although we've observed a slight slowdown in cases in the last 2 weeks. But we know that many things are happening daily, including we've just had the Eid celebrations that continue to fuel the spread of the virus. So we need to be monitoring these changes daily and monitoring these limited gains closely. We know that we're not out of the woods yet by any means. This has been the fastest rising surge, powered mainly by people's fatigue with COVID-19 preventive measures, with the presence of more transmissible variants and the continent's very low. About 30 countries have used up more than 3/4 of the vaccines they received. Encouragingly, we're beginning to see positive signs as vaccine deliveries to Africa are picking up pace after coming to a halt. So considering a 2-dose schedule, as is the case with most of the vaccines available, 820 million vaccine doses are needed to reach the target of fully vaccinating 30% of Africa's population by the end of this year. In comparison, with only 245,000 doses that were supplied to just 6 countries in the whole of June, over the past week alone, 3.8 million vaccine doses were delivered to 13 countries through the COVAX facility, bringing the total doses delivered to the continent to 82 million. These recently delivered vaccines are part of 60 million doses that COVAX has allocated to 49 African countries to be shipped between now and September. Africa still needs more than 700 million doses to reach the 30% year-end target. And COVAX has also sealed deals with Sinopharm and Sinovac to supply 110 million doses for immediate supply to low-income countries, and out of these, 32.5 million are coming to Africa. These doses have been allocated to countries this week and will be delivered as soon as the countries are ready to receive them. With more vaccine candidates and manufacturing sites at the tail end of the review process for approval by WHO for emergency use listing, the COVAX facility is confident, or hopeful, let me say, that it will meet its end of the bargain to deliver at least 520 million doses to Africa by the end of 2021. We are really pleased and we commend the action of the African Union in also going out and seeking vaccines. And they have announced plans to start delivering the 400 million Johnson & Johnson doses that have been acquired and procured on behalf of African countries. This collective efforts needs to include increased donations from high-income countries. We have very much appreciated the action of the US government in providing millions of doses already through the COVAX and in agreement with the African Union that have completed. So we expect countries that have completed vaccination of most of their vulnerable populations to join the US and to increase the doses that they are proposing to deliver and do that urgently. And also, very importantly, to release for purchase by COVAX and AVAT the reserved doses of vaccines that they have already prepaid with the manufacturers. In short, we promote very strongly the enlightened self-interest aimed at reducing the emergence of more variants for everyone by these countries donating and allowing the sale of the vaccines that they have already booked, so to speak. With the expected influx of vaccines, it is crucial that countries scale up all the aspects of vaccine rollout to reach as many people as possible. This entails mobilizing adequate resources, including finances for the vaccination activities, for logistics and the personnel, as well as addressing any concerns by communities, including those fueled by misinformation, to increase vaccine confidence and demand. We continue to support countries to better plan and cost vaccines, operational and delivery processes. In the first phase of the rollout, countries were unable to lock out funding very often because costing plans often omitted critical expenses such as the cost of remuneration of vaccinators, administration, cold chain storage, logistics, and distribution at the subnational level of vaccines to the delivery points. Our experts have been on the ground since the onset of the pandemic, working with governments and partners to curb the virus by boosting key response measures, including through the testing, contact tracing, treatment, vaccine preparedness, rollout, and monitoring of any adverse events due to the vaccines. To date, WHO in the African region has deployed over 700 staff and consultants to support national authorities in the COVID-19 response. In addition, almost 1,300 of our staff have been repurposed to focus on pandemic control activities. African people, just like the rest of the world, are eager to see a return to normal life. But we must all do our part by getting vaccinated when the occasion is there for us, when the jabs are offered to us, and adhering to the preventive measures that have been so important in limiting transmission of the virus in Africa. I believe together we can begin to turn the tide against this untold human tragedy. And I look forward very much to our conversation today. And thank you once again for having joined us. Thank you, John, for having invited me to join. I hand over back to you, Madam Moderator.
Thank you very much, Dr. Matshidiso Moeti of the WHO, talking to us there about vaccine acquisition, as well as some of the response activities that are being undertaken by the WHO. Now it's time for us to move into our question and answer session. But let me just remind you of how you can send in your questions. So the first one is to use this WhatsApp number, +251 94550 2310, +251 94550 2310. Alternatively, you can come to us live or use the question and answer section. So let's move on to our first question for today, and it's coming from Kara Anna, who is with Associated Press. Kara says, thank you for this briefing. Now that Tanzania has started COVID-19 vaccinations and Burundi says it will accept the vaccines, that leaves only Eritrea. What reasons has Eritrea's government given for not pursuing vaccines? Dr. John, you will take that first question.
So thank you, Kara, for that question. We don't have a specific reason why Eritrea has not made a pronounce itself on that, but we continue to hope that the situation will change and we'll continue to engage them. As I just mentioned, I just came back from the Tanzania last night and had a very good conversation with the leadership of that country, the new leadership, and the president herself, President Excellency Samia Hassan, was very supportive. And we spoke about the COVID pandemic very openly and very freely. And before I left yesterday, I was delighted to see that she has taken her vaccine. And we are committed to working with them to rolling out the 1 million doses of vaccines that they just received as part of the US supply. So we are very encouraged. The Minister of Health was extremely supportive, and we look forward to doing our little best to support that effort. Similarly, in Burundi, we'll continue to engage with Burundi. And in the coming weeks, of course, we will be intensifying our efforts there to understand the gaps and areas where we can support them. And similarly with Eritrea. So again, just to conclude, my answer on that question is that the concept and philosophy at the African Union is that we leave no country behind, because we are not going to win this battle against COVID-19 on our continent if any country is left behind. So we take that very seriously, and we will keep you updated as we make any significant engagements with any of these countries.
Thank you very much. Let's go to colleagues coming online. And the first one today is Daniel Arap Moi. Good morning, Daniel. Please tell us your news agency and ask your question, as well as tell us who it is directed at. Over to you, Daniel.
Well, thank you very much. My name is Daniel Arap Moi from CGTN Africa, based in Nairobi. My question goes to Dr. Moeti, the first question, and the second question I'll forward to CDC. To Dr. Moeti, researchers are now raising concerns over cases of individuals who are testing positive for coronavirus despite being fully vaccinated. Now, this then raises the question, how protected is someone who has already been fully vaccinated against COVID-19? And how rampant are cases of breakthroughs in Africa?
Dr. Moeti.
Okay, thank you. That's a good question and an active concern in many countries today. I think that it has been known that the vaccines will not altogether prevent transmission. I think some of the ones with the highest efficacy, like the Pfizer-BioNTech, cause people not to have very low viral loads after being fully vaccinated, meaning that their ability to transmit the virus to others is limited. But what we have understood is the main benefit of these vaccines, of all the vaccines, is preventing people getting severe forms of the illness such that they need intensive care and preventing people from dying. So it seems also that the Delta variant, which is becoming predominant now virtually all over the world, which is certainly circulating in over 25 countries in Africa, we believe, is more transmissible and is more transmissible even among people who have been fully vaccinated. So I think people need to understand that we take the vaccine, of course, to reduce the rate of transmission of the virus, but also very much to reduce severe illness and to reduce deaths. As you are aware, there is a debate going on now, and I believe that the American government is about to issue guidance on the use of masks by people who have been fully vaccinated in the context of this highly transmissible Delta variant, which is circulating in many, many countries. So what I would say to people is that do take the vaccine. It will reduce your chances of being infected. It will not eliminate them altogether, but we have seen there are very few deaths among people who've been fully vaccinated, and there are very few severe cases of this form of illness among people who are fully vaccinated, and that is a huge benefit already in terms of our objectives in the vaccination.
Thank you very much, Dr. Moeti. I think we can now move on to Judith Akolo, who is with the Kenya Broadcasting Corporation. And she says, I would like to ask Dr. John Nkengasong, is Kenya also experiencing its fourth wave like Tunisia and Nigeria? Because yesterday, Kenya registered 1,006 new infections from a sample size of 5,584. And an infection rate of 18%. What determines a new wave? Is it the infection rate or the death rate? Dr. John.
So thank you. I have not, I've been traveling the last couple of days, so I've not looked at the data country by country as I usually do. And tomorrow will be that day where we look at the entire spectrum of where each country is, and I'll be able to look at Kenya more closely to see how their daily, the 7 days moving average is where it's trending towards. So I mean, we look at the 7 days moving average and to look at and make a determination if they continue to bend the curve or the curve has flattened and then it's ticking up. So that is at that point that we raise an alarm that a country might be moving towards a subsequent wave. So I think that is, at this point, Judith, I cannot tell you if, based on the information that I have, that Kenya is actually moving into the fourth wave or not. But that information should be made available, hopefully next week when we have this discussion.
Thank you for that. The next one is for Dr. Moeti. And it's coming from Bonisile Makubu from the Times of Eswatini. She says countries like Eswatini are seeing high numbers of new infections among the 0 to 19-year age group. Considering this, what would you advise on the opening up of schools?
Okay, thank you very much. You know, all countries are facing this dilemma between letting life go back to normal and really covering some of the gaps that have been imposed by the lockdowns in all spheres of life, economy, education, very much, which is a big concern, and other socioeconomic activities against the risk of worsening the situation in terms of transmission. Certainly, if young people are going to be going back to school, which is a very important objective, then there needs to be a lot of investment in ensuring that this does not result in super spreader events within the classroom and children taking the infection back home where they are likely to infect adults who may be vulnerable to falling seriously ill and dying. I think that is the logic. So each country needs to look at its own situation. What is the rate of increase of cases? And I think that Eswatini is among the countries that have been among those experiencing what we call resurgence. So there needs to be a lot of caution applied to whether the prevention measures, the distancing, the wearing of masks can be put in place effectively in Eswatini so that we don't have young people who are at school being the source of infection to those who are more vulnerable before the vaccination of older people who may be vulnerable, who are vulnerable to more serious illnesses can take place. So it is a balancing act, and the government needs to weigh this up very carefully. And I would say that, of course, we would like children to go back to school. We want girls especially to go back to school, so to minimize the risk of children dropping out forever, which is a huge risk in the current situation. But we certainly would advise against doing this without putting in place the proper prevention measures to ensure that this does not worsen the overall situation in the country. And we know the measures to take, to put in place to ensure this.
Thank you very much, Dr. Moeti. Sophie Mukwena is online, and Sophie is with the South African Broadcasting Corporation. Good morning, Sophie. Please go ahead with your question and just tell us who it is directed at.
My question is directed at both Dr. Moeti and Dr. Nkengasong. The issue of the third wave, taking for example South Africa, we were experiencing a third wave, and last week the president took a decision to relax measures that were intended to fight this third wave. Is it too early? Because yesterday, the numbers that were reported were very high. But secondly, much as there was decline in positive cases, the death toll is much higher than the first wave and the second wave. What could be the disjuncture? And also the recent unrest and gatherings in South Africa, at what point are we likely to see the implications and the impact thereof on rising numbers and death toll? And yeah, are we going to really have a break before we go to the fourth wave?
All right, thank you very much, Sophie. Dr. Moeti.
Yes, thank you. I mean, again, a question of balancing between the situation of the pandemic, the severity of the third wave, and indeed there is a third wave in South Africa, which has been also spreading to the sub-region because of the close links between South Africa and neighboring countries, and the need to reopen the economy. I think the situation in South Africa, you mentioned the recent unrest, looting, etc. which I think we need to acknowledge may have been triggered by particular events, but had as part of the background the severe economic impact on low-income people of the COVID-19 pandemic, including some of the measures like the lockdowns that needed to be imposed. And I think the government had to balance that against what was emerging as a slowing down of the pandemic. There had already been a decrease in the number of daily cases. So it's, again, was having to see the measures of opening up, taking into account the severe economic impact and reinforcing the prevention measures at the same time as loosening up some of the lockdown measures. What I do know is that what was opened up was, for example, inter-provincial travel now. The curfew remains, but perhaps is later. And then restaurants have been allowed to open, and the sale of alcohol is allowed. I think that the country now has gained experience in monitoring how things are going. Clearly, we may be expecting to see, following this reduction in cases, an increase in the cases where some of the worst gathering, when the looting was happening, occurred. This should be starting to show very soon. But I believe that before this decision was taken, the government must have taken a very detailed look at the trends, at the measures, at the available resources for ensuring these measures are implemented. And we know that they are able to monitor the situation and adjust. They've had experience now in readjusting these measures closely. So your question is very valid. I'm certain it's being analyzed on a day-to-day basis. And if the trend seems to be going back up again in a sustained way, I'm certain the government will take the right decision then. It's very much a balancing act for all countries.
Thank you. Dr. John, do you have a comment on that question?
No, I think, Dr. Moeti very nicely laid out the explanation. It's a balancing act. The government is faced with a choice of saving lives and saving livelihoods. And that is a situation that will only be addressed once we roll out vaccines in a significant way. And South Africa has one of the best public health experts that I can think of, and they do analyze the data very regularly. And I was in South Africa just 5 weeks ago, met with the ministry, met with researchers from Caprisa, and very impressed with the way they are looking at triangulating data to use that to guide the response. I absolutely have no doubt that they know what they are doing. And this is the third time they are bending the curve. And let me just say that the 15% decrease that I just mentioned, when you look at last week compared to this week, is largely due to what is happening in South Africa. So I think that South Africa has become, just like Kenya, they've become veterans in bending their curve down and relieving their health system. The people always ask me the question, which are the countries in Africa that have done better than others? I say, well, most countries in Africa have done very remarkably well. Nigeria, South Africa, Kenya. Because if they were not doing that, you probably would see an escalated situation where it will be completely, the health system will be completely overwhelmed. So if you plot those graphs there, you see nice peaks, they come down, they go up, they come down. It's because of the balancing act that Dr. Moeti mentioned between saving our economies and saving lives there. So you continue to see that, Sophie, until we are at a steady state where vaccines would have been introduced and everybody can actually begin to, life can actually begin to return to normal.
All right, thank you very much both. Let's move on now to Hilary Orinde from Agence France Presse. The Burundi Health Minister, Dr. Ndikumana, yesterday said they are ready to accept COVAX vaccines from the World Bank. However, the country has refused to sign forms asking for commitment to reimburse or manage the side effects linked to the vaccines. What do both the Africa CDC and the WHO have to say on the issue? So I will give that to Dr. John, and then we will move on to other questions because we have quite a number coming in. Dr. John, over to you.
No, wonderful. Tomorrow we have a meeting with all ministers of finance and ministers of health and the World Bank and the AVAT team, that is the African Vaccine Acquisition Task Team. And I'm very encouraged that Burundi will be part of that, and that discussion and dialogue on how to acquire these vaccines and roll them out. We stand ready, just to put it very bravely, to work with Burundi to provide them with the technical assistance so that they can deploy the vaccines in all dimensions and not just look at the immunization, but also monitor the effect of the vaccines going forward. I haven't seen that statement from the Minister of Health, so it is difficult to comment with specifics as to what the Minister is referring to.
All right, thank you. Let's say good morning to Girum Chala. Girum, good morning, and please go ahead with your question. Just tell us who the question is directed at.
Thank you so much, Madam Girum Chala, CGT, and based at the African Union headquarters. Dr. John, good to hear from you, and Dr. from WHO as well. My question is one, and it's for both of you. Why don't we talk about the economy of Africa? I also want to take you back of your plan of saving lives, economies, and livelihoods. What is really happening? Are you talking to the respective departments at the Commission, for instance, the Economy Department, Agriculture Department, and the others? Because COVID-19 is still making people's lives difficult. Economies are going down. Some of the economies are unable to recover. So what is really happening? How is the world going to support Africa? And if there is any progress in this regard, can you please share with us? Thank you.
All right, I think you've spoken there about the African Union, so let me give that to Dr. John first.
Yes, I think, that's a very good question. I think our briefings tend to focus on the health component. But there's a lot going on that is not being put out there, or is put out there through different channels by the African Union and the UN Commission for Africa, Economic Commission for Africa, that is headed by Dr. Vera Songwe. And I'm sure if they do briefings, you hear a lot there. So and we work very closely. We, the Africa CDC, work very closely with all of these, the Commission and the Commissioner Amani, Commissioner Muchanga, and others. And from what I know is that there's a lot of intense work going on with to engage with the World Bank and the IMF on the special drawing rights that will make money more available to countries to stimulate economies. If you recall, Giram, so many developed worlds have poured in trillions and trillions of dollars, and that has not been the case with many African countries. So I think these special drawing rights and other mechanisms that our economy, the AU special invoices that were put in place by the President Ramaphosa, who is still a COVID champion, but at that time, last year, he was the chair of the African Union. I was still working tirelessly to unblock some of these economic measures. I think that is, so the saving lives, livelihood, and economy is still so much alive. I think we will continue to work with member states to implement the trusted travel, because that is also part of another dimension that is impacting our ability to move. And if it impacts ability to move, it impacts our economy. I think there's a lot going on in the economy front, which is not usually reported during these press briefings.
All right, thank you very much, Dr. Moeti. Do you have a very brief comment to make on that before we move on to the next question?
Yes, I think I'll agree with Dr. Nkengasong, and just that, of course, there's been a lot of discussion about rescheduling debt payment. Many African countries have high rates of debt to international financing institutions, and that's part of that support. I mean, I can only add that making vaccines rapidly available to African people to be deployed urgently would be one very good contribution to fastening or speeding up the reopening of African economies so that people at the lowest level can go out and earn their livelihoods. So if we can say anything to the economic community, indeed, the financing is very important, the debt rescheduling is very important, and providing African people with vaccines is one important way also to support the economic recovery sooner rather than later.
Thank you very much for that. Elizabeth Merab, who is with The Nation in Nairobi, Kenya, says there have been reports of adverse effects following immunization, AEFI, among women regarding interrupted menstrual cycles, as well as diagnosis of clots in people who are young and did not have clots before. Have you heard of these AEFIs and what's being done about it? That's for you, Dr. Moeti.
Okay, thank you very much. We are monitoring with our WHO country teams on the ground and our group that's working on vaccines, the AFEIs that are documented in countries. What we've observed with the data that we've had so far, which admittedly is not complete, is that there have been relatively few reports of severe adverse effects among the people in the region so far. We recognize this surveillance, if you like, of AFEIs needs to be strengthened, but we have largely received from these data collection systems indications of the milder AFEIs. Of course, what we are doing as well with our teams that work on case management is to sensitize the treatment side of this, sensitize the population of the type of symptoms that must make them report immediately to a health facility to prevent these severe AFEIs resulting in a loss of life. So that's something that we're very much working on. But so far, we have not had reports from the surveillance system that's in place of many cases of these severe AFEIs, but certainly they're taken into account in the process of both monitoring from the vaccinated and case management and sensitization of populations that are vaccinated.
Thank you very much. The next question is for Dr. John, and it's coming from Alex Winning from Reuters news agency. When the African Union and AVAT announced the Johnson & Johnson deal, it was said that 220 million doses had been secured, with an option for a further 180 million. Could you confirm that the 180 million option has now been taken up? How is that option being funded, given that Afreximbank's facility only covered the first 220 million doses? And also, could you say how many of the 400 million doses will be delivered in this year of 2021?
No, thank you. Very, very good question. Let me start at a very high level. Very good, remarkable progress has been made with respect to acquiring the 220 million doses of vaccines, and then even moving into the 400 million doses of vaccines. Through the efforts and partnership with the World Bank, it is very possible that we will exhaust those 400 million doses of vaccine, because many more countries have now, through this, the support and partnership of the World Bank, come into the fold to acquire additional vaccines there. So we are very pleased with where we are at this point with respect to those vaccines. As I indicated earlier, the distribution of those vaccines will start next week. And as we speak, communiques are being written to countries, and engagement. We'll be working with UNICEF that will be mainly distributing the vaccines on behalf of the AVAT. So we anticipate that the first a couple of 8 million vaccines will begin to roll out in the coming days to member states. Then come September and October, the number of doses will escalate. I cannot give you, I don't have the specifics of how many vaccines will roll out in September and how many will roll out in August and November. But all of that information can be made available, and I can promise you that we'll bring that information to you next week. I thought last week that Mr. Masiwa, who is coordinating the efforts, actually expanded on that. So that's why I didn't pay attention this week to capture those numbers. But it is exciting. One of the things that I just spent the whole morning today doing was working on the communication and engagement with countries to alert them that these vaccines were coming. I can't believe we are discussing when the delivery of those vaccines will occur. It almost seemed like an eternity that at the start of the year, we're discussing the prospects of signing the contracts and getting the vaccines and getting to 220 million. And today we are discussing when the delivery will occur. So I'm very, very encouraged and remain hopeful. As I always said, we celebrate every little move during this pandemic because it will contribute to victory, overall victory, to winning the war against the pandemic.
Thank you very much. Let's move on to a question which I'll throw to Dr. Moeti, and it's coming from Sarah Jerving, who is with DEVEX. She says, as vaccines come into countries, are there concerns about the absorptive capacity of these vaccines? Are COVAX allocations determined by the absorptive capacity of countries? And what sort of expiry dates do you anticipate the COVAX doses to have?
Thank you. That's a very important question of the moment as the prospects for vaccine delivery, as I said in my statement, start to improve. When COVAX distributes or allocates vaccines, I think the primary determination is to ensure equity among countries based on agreements that have been reached on them. That's the kind of core principle of the COVAX. And then, of course, there's also a look at what countries have been able to absorb before. Being practical, we want to minimize countries having to redistribute vaccines that have been deployed to them, because that, frankly, spends more time and energy, which could be used in the rollout of the vaccines themselves. Countries have done a lot of thinking and micro-planning to prepare for receiving the vaccines, and we have worked with partners like UNICEF and others to support this process. They've learned a lot as well from the first round of delivering doses of vaccines about some of the issues that I mentioned before, being as meticulous as possible about mobilizing additional capacity of people who will actually deliver the vaccines, vaccination sites, registering people who are going to be vaccinated, and then the logistics, supply chain, and even the financial resources, making sure that money reaches the people who have to deliver the vaccine and doesn't stay in the capital cities, as sometimes happens when we run campaigns. We are looking, and I don't have the details here, at expiry dates of some of the vaccines that are going to be delivered. We are particularly concerned that some of the donations may have very short timelines in terms of expiry dates, and this is something that needs our careful monitoring always. What we do is ensure that the countries have this information as they're receiving the vaccine, so that they structure the delivery in order to minimize vaccines reaching their expiry date before they're used. So this is something that we're very much aware of in our work with countries. But as Dr. Nkengasong was saying, we are now at this very encouraging phase after a bleak June of vaccines becoming available. We're working very hard to make sure that the capacity is ramped up, the partners provide the support so that every single dose can be translated into a person vaccinated.
Thank you for that. We have questions coming from...
Wait, let me just add. Let me just add that, Win, that since Dr. Moeti touched on the donations, that we, of course, are extremely grateful for all the donations that are coming in to the continent, be it through COVAX or AVAC or bilaterally. We really appealed for anyone donating vaccines to the continent that they should be mindful of the expiring dates. And that way we do not end up with another issue and a different narrative on the continent that vaccines have been donated and they were not used, and because of the expiring date. If the vaccines come with very short expiring date, it will be difficult for the countries to absorb that. And then the narrative will be that the continent didn't use vaccines. I think we should avoid that kind of a narrative and make sure that we coordinate our efforts as much as possible, keep the communication lines open, and only make sure that we donate vaccines that will have at least a 3 months to 4 months shelf life. I think that is very important. Otherwise, we'll easily find ourselves into a very confusing scenario where the narrative can easily be misleading.
Thank you both. We now move on to questions from Paul Adepoju, who is with the journal Nature and Health Policy Watch. So he says Pfizer data has suggested a third dose to boost protection against the Delta variant. Will the World Health Organization and the Africa CDC advocate for this? Dr. Moeti and Dr. John, what do you consider to be the biggest challenge for the massive rollout of COVID-19 vaccines, and how can the countries overcome these challenges? So let me start with Dr. John.
So in my view, the views of Africa CDC is that we can get this done, okay, as a continent, if and only if we have a predictable supply of vaccines. That is why I go back to my earlier comment about the need for all these donations to be coordinated so that we know exactly which vaccine you are going to get, a country is going to get, and then you can plan with them. Then we also know about how do we engage the community and make sure that the community is part and parcel of this vaccination exercise. Vaccines are different. If a country is receiving the Moderna or Pfizer vaccine, it's very different from if they are receiving the AstraZeneca or the Johnson & Johnson. So they need to prepare in function of that. And if we have to conduct a massive campaign, we need to be sure that if you shake the trees, there will be vaccines. Excuse me. There will be vaccines for people to people to go get the vaccines there. So that is extremely important. That if we do this in a coordinated way, then we at least can support countries to roll the vaccines out speedily once they come in country. But if we do not do that, then we end up with a lot of uncoordinated efforts that will result in countries not being able to absorb the vaccine. Say, for example, if you send out 200,000 doses of Pfizer vaccines into a country that has no ultra cold chain, it becomes extremely challenging for them to use the vaccines. Then you already have primed or generated a scenario where the vaccines will not be used. I think that is as basic as that.
All right, thank you for that. Dr. Moeti, do you have an additional comment before we go into our last question for today?
Yes, I agree entirely with Dr. Nkengasong's comment. I think that, as I said, some of the, certainly getting going from a kind of drought to a flood, uncoordinated, is the worst case scenario, and we need to avoid that. And one of the ways to do it is to be communicating with each other, the different platforms that are mobilizing vaccines, and very much communicating with the countries so that we know their plan, we know their capacities as we are making a decision to provide them with a vaccine. And there is a close communication about saying yes to vaccines. Countries clearly are keen to get every single dose that they can, but these rules must apply. I also think that, some of the financing, and I was very glad to hear John talk about the financing with the World Bank. We had noted in the first round that countries underestimated the needs for money to actually run the delivery campaign. This is very important. From the many campaigns we supported countries to carry out before, if you're not paying the people actually doing the jobs, you get into trouble, and that kind of goes down the chain. So these are some of the things that we think need to be taken very much into account. I wanted to comment a little bit on the third dose, so-called booster dose, that WHO is looking at this. And I know that after the statement by Pfizer, several countries are also looking at this in terms of the evidence for the need for a third dose. We think in WHO Afro that it's very important that we be meticulous about this because, of course, our concern is decisions to provide a third dose might influence the availability of vaccines for our countries, which are already going through a very difficult situation. So we would like to advocate strongly that decisions about third doses be made absolutely on the basis of data and really robust data, because such a need being thrown into an already quite vulnerable situation at the global level could have huge implications for supplies as countries make their decisions about what they see as the risk to their populations and decide to take on a booster dose. Meanwhile, our colleagues in WHO are also looking at this question so that we can provide point of view and guidance for member states. Thank you.
All right,
and
thank you.
I would just further add that, I mean, I fully agree and maybe supplement that our priority is to vaccinate many more people with their first and second doses. I think as a continent that is extremely deprived of vaccines, we are not even thinking of the booster yet. We should really aim at scaling that up as quickly as possible and improving our numbers from the 1.5% of the continent that is fully immunized to some much higher level before we think of boostering.
All right, thank you very much. Our very last question is coming from Addis Getachew, who is reporting for Anadolu News Agency in Addis Ababa. He says, a question to Dr. Moeti. You just brought home to us the news that 60 million doses of vaccines would be made available between now and September under COVAX. How far would that amount go in terms of helping the continent to meet its targets? And how far would it go in terms of narrowing vaccine availability gaps between countries on the African continent?
Okay, that's a very important question. I mean, clearly, if I answer it simply, it would be to say that it would be progress compared to where we are today, but it would not be going far enough. We've estimated that we need about 820 million doses to be able to reach a coverage level of 30% of the population by the end of the year. So 60 million certainly is a step in the right direction, but it is nowhere near what is needed to reach that, that ambition, that target by the end of the year. So clearly, we all need to be working together, and I'm pleased that we've had this announcement that J&J vaccines mobilized by the African Union are now going to start rolling out. We need to put all of that together and see what it amounts to. 60 million is significantly more than has been delivered up to now. We've reckoned that about 80, in a short space of time, about 80 million or so doses have been delivered up to now, but clearly that needs to ramp up significantly by the end of the year.
All right, Dr. John, do you have a comment on that question?
Yeah, just to agree with that and say that I think Dr. Moeti has put that very nicely in the context of what our needs, the 820 million. I think we have set ourselves a target of at least immunizing 60% of our population of 1.2 billion people by the end of 2022. And that brings us to about 1.6 billion doses of vaccines that we'll need if we are using the 2-dose vaccine. So every donation or any announcement that we receive should be put in that context, that we are a long way from achieving our target. However, a journey of 10,000 any progress that is made available. The situation of the variant, the Delta variant, also makes it complicated for our vaccine target. When we set up that target of achieving or vaccinating 60% of the population, we're using an R naught, which is the rate of reproduction of the virus that we understood last year at 2.0. Today, with this Delta variant, the R naught is around 6 or 7, which means that you may actually need more vaccines than previously estimated. And also that the younger people are being infected and coming down with illness also changes that equilibrium. So we may need more vaccines than we initially stated. But the good news also, which I keep looking for good news to celebrate, is that we've been hearing all these announcements that South Africa, Morocco, Egypt, Algeria will be producing vaccines, and some of them have very aggressive timeline. I just left the ambassador of Morocco a few minutes ago in a discussion where he was informing me that their target is to, in the next 5 months or so, put up manufacturing fill and finish facilities in Morocco that they can produce up to about 5 million doses of vaccines a month. That is all welcome news. So I think the point is that we are far from our target. The situation gets complicated every day by these new variants that impose new demands on us. The vaccine scenario is opening up favorably, but we should also be mindful of the fact that vaccines plus vaccination equals life safe. So just having the vaccines without a strong vaccination program will not save lives and save economies.
Thank you very much, John. It's now time for the summary highlights from our two panelists. Let me give the floor to Dr. Moeti to very quickly summarize the key points that you want people to take away from today's briefing.
Yes, thank you. First, again, my sincere thanks to Dr. Nkengasong for the invitation to join. I was very pleased to join this press conference. And then just to say that, you know, we are going into a phase now where possibilities are opening up, where vaccines are going to be becoming more and more available in the face of waves and in the face of the emergence of variants, in the face of exhausted populations wanting their lives just to go back to normal. So it demands from all of us, starting with the leadership, right down to people at the community level, and very much those of us who work in support of our member states, to be agile and to learn from what we have seen as experience, and to be informed by data and evidence in every single step that we take in this process. And then, of course, it very much needs that global solidarity that starting to see emerge, which needs to emerge much more strongly in terms of collaboration and delivery on the statements of those sharing urgently in the ways that we've talked about. And then finally, it rests on each and every one of us as individuals to do our part, meaning wearing our masks, perhaps even if we've been vaccinated because of the variant that's circulating now, as we try to reestablish normal life. And just to assure that from WHO, we are very determined to continue to work with our member states in partnership with the African Union, the Africa CDC, and the rest of the international partners that are supporting this effort. Thank you.
Thank you, Dr. Moeti. Dr. John, your final summary highlights.
No, thanks so much. I think there are two things that I would like to leave the press briefing with. One is that we have to continue to rely on what works. And what has worked so far for us now is the implementation, a constant, consistent, and persistent implementation of public health measures. That is the only tools, those are the only tools that we have in our hands, and we know they work. Must do work, and we should continue to do that where that consistently is, while waiting for vaccines to come. And we've all discussed on this platform that vaccines are coming, but it will take time for it to reach a critical level where we can actually relax and feel more comfortable there. And there's also the unknowns. We've lived with this virus now only for 1.5 years, and we know what we know. And there's a lot that we don't know about this variant. Today, we are discussing the Delta variant. We don't know what other variants will emerge tomorrow. And so we just need to continue to implement those public health measures that will enable us to keep blunting the spread of these viruses, relieve our health systems and hospital systems, and enable us to vaccinate at scale and at speed. The second thing is the vaccine itself, that we are pleased with all the progress that is coming, but we'll also call on you, the media, to work with us so that we continue to galvanize the community. Without the community support and cooperation and full leadership, we will not be able to roll out vaccines at speed. I think we just have to be very clear with that. So this will all require our efforts, and individual efforts, and our collective efforts to make this happen. So let me just conclude by again thanking Dr. Moeti. I know that how busy your schedule is for scheduling and allocating a full hour to discussing this very important topic that our continent faces. I think I'm very encouraged that the leadership continues to be behind us. President Ramaphosa, as the COVID champion, continues to be briefed every week on this. We'll be having a commission meeting today, which will be chaired by him, the commission meeting on COVID in Africa. and Chairperson Musa Faki and others that are really driving these efforts there. So thank you all. We'll continue to work with you to bring you the latest information, especially as we begin the distribution of vaccines from the AVAC platform.
Thank you very, very much. Today we were joined by Dr. Matshidiso Moeti, the Director of the World Health Organization's Africa Region Office, and also by Dr. John Nkengasong, the Director of the Africa Centers for Disease Control and Prevention, who is our host for this press briefing every Thursday. So thank you very much to our two panelists. Thank you to colleagues from the media who have been with us for the past hour, and anyone else who might have been joining us since 11 a.m. So let us meet again next week on Thursday at 12 noon East African time. Bye-bye for now.